So, as you know, guys like to brag. Guys who are doctors really like to brag. And guys who are doctors who are surgeons are just unbearable. So, you asked me about diabetes, and I'll give you $20 for asking that question, because we really like to talk about diabetes. Just as a bit of background, diabetes is a really deadly disease. In the United States, it's responsible for lots of terrible complications, like heart attack and stroke. Complications include blindness and kidney failure and things like that. So it's really serious. And when I was a general surgeon, I was often called as one of my responsibilities to see diabetics who'd gotten an infection in their foot, turned into a serious infection, spread, and led to gangrene, and I would have to do an amputation for diabetes. As a young surgeon, I had kind of a weak stomach, and when I had to give blood my first time for a friend of mine who had been in a motorcycle crash, I passed out. And as I was waking up, the nurse who was patting my head with a cold compress said, "Honey, I guess you're going to have to be a psychiatrist." Well, I tell that story because I got used to a lot of things in surgery. You know, when you make the incision and you see blood or infection or things like that. But I never got used to cutting off the leg of a diabetic patient. That's just a very terrible, very blunt, a very old-time treatment, and it's just very rough to face. So, I don't like diabetes. And one of the neat things that we began to find over the past 10 years is that patients of ours who are overweight, who have diabetes, who have the MGB, their diabetes goes away. Now, just recently we had a student who, her and her mom both had surgery with us, and she's from Canada. And she came down to do a rotation, and I said, during your rotation you can choose what you'd like to do. And I said, if you want, we could do a research project. And she said, I'd like to do research on diabetes. So we did a survey, like I talked about this morning, and we got data back on about 700 MGB patients, of whom about 25% were diabetic. At 3 years after surgery, 93% of the diabetics were taking no medicine for their diabetes, and I would call that a cure. So we had a 93% cure rate of diabetes. This is where you guys applaud. No, this is where I applaud. So we hate diabetes. We love seeing it, and we really feel like we help diabetics. And imagine that you could get rid of your diabetes, your insulin, your oral hypoglycemic, sticking your finger with a needle for a 30-minute surgery.